In this video, we are going to continue our discussion on the history of Chinese medicine, the development of traumatology. In this session, we're going to introduce a few books. The first one is 先受李商续断秘方. 秘方 means secret, 方 formula, so which means this is secret formula. 先受 先 actually refer to celestial being, or in the other simpler words, is actually a kind of a god in the heaven. So means introduce, so which means this author tried to say this book, this formula was introduced from the heaven, so it's not human wrote it. So this is also similar to 黄帝内经 when we introduce the title of 黄帝内经 神农本草经. This is the tradition or the habits in the previous years that people want to use the important figure in the history, either in the history or in the legends, that to emphasize the importance, also the efficacy of this book. So 先受 means the celestial being introduce this book. On what? 李商. Li means to manage or to deal with trauma. 续断 续 means to reconnect. 断 means fracture. Or so 断 in Chinese, when we said something they separate or they broken. For example, a stick, a wooden stick. Once they broken, so for example, it's stick. Once they broken or they disconnect, we said 断. So 续断 means 续 means reconnect the fracture. So you can see from the title, this book is actually a monograph on traumatic injuries, mostly refers on dislocation of the joints, the fractures. The author is Lin Daoren, comprising around 841 AD to 846 AD. This book provides a systematic approach on the treatment of fractures. For the fracture reduction and fixation, the principle of combining dynamic and static methods was introduced. So this type of method is actually, until today, we still encourage it to apply. The reason is because normally what happens after fracture is the doctors will apply plaster on they're going to reconnect the bones first, and then they're going to apply plasters on outside the fracture area or your extremities. But the side effects of this process is, after a long time, static limitation of the movement, the muscle will develop into atrophy because of the long term without movements. So in this book, the author Lin Daoren, he actually encouraged us we should combine the static methods, but in the meantime we need to encourage the patient to move, to use the extremities, the fracture area as well in the meantime. This is not only to avoid the muscle atrophy, but also you also can avoid the clots, the formation of clots due to lack of movement. So even today, in surgery, even in Western medicine, we still encourage this type of combination. Although this depends on the severity of disease, also depends on the period of the treatment in the entire process of the recovery. So in the recovery process, we encourage dynamic and static methods at the same time. Static method means the patient should not move. The affected area should stay still, don't move. Dynamic means that we encourage the patient to move around, so that is a combination. In this book, the author also introduced the cases of shoulder joint dislocation and how to reconnect the joints. And this type of method still commonly used today in clinical practice. For example, this image demonstrates how to reconnect the joints, the reduction with chair the techniques was employed. And also in this book, there were over 40 formulas were documented. This is also very typical in Chinese medicine traumatology, because normally what happens in traumatology or traumatic injuries, the treatment as well as surgeries, what happens is after surgeries, and then the doctors will allow you to recover automatically, to wait for recovery, to wait your body to heal again. But in Chinese medicine, after surgery, we will advise you from dietary medicine point of view to introduce you with oral intake, oral medicine with herbal medicine have the function to promote recovery, to promote circulation, as well as to promote the healing of muscles and bones. This is linked back to the theory. Because the spleen in charge of the muscles and the kidney in charge of the bones. So we can use internal medicine to promote the healing, to speed up the healing of fractures, and also to strengthen the muscles, to strengthen the ligaments, to avoid the next onset of disease, such as the dislocation of joints. It can be the weakness of ligament and muscles. So these formulas were applied during the treatment of traumatic injuries. This is also very unique in Chinese medicine, the combination of external treatments and internal treatments.有类灵方 is another book on traumatology, compiled in 1331 AD. There were 22 volumes, including one specifically dedicated to traumatology. 十一德教方 compiled in 1337 AD. The use of anesthetic medicine substance according to individual body constitution, age, and medical conditions. As we mentioned previously, from the beginning, from the stories of Bianque, from the historic events of Huatuo, the Chinese medicine practitioners always seek for better treatments, better solutions for diseases, especially to reduce pain. That's why in Bianque age, we introduce the story of toxic wine. Bianque asked the patient to drink the toxic wine, and the patient will sleep. After the patient, while the patient was sleeping, then Bianque can perform surgery. And then afterwards, about 1,800 years ago, Huatuo is real figure in the history who was talented in surgery. He used Ma Fei San. Also, Ma Fei San can reduce pain. And now, about 700 years ago, from Huatuo until 十一德教方, that's about 1,000 years afterwards, the medicine keep developing, especially for anesthetic medicine. Also keep developing in Chinese medicine. This author, he points out that the use of these substances to reduce the pain, you need to use according to individual's body constitution, individual's age, and also the medical conditions. You see, now the concept is very close to our modern times. Even nowadays, in anesthetics, the doctors also need to consider all these differences among patients in order to introduce or to design the way how to reduce pain. So these thoughts, these concepts were recorded in 十一德教方. This is also just a demonstration of the recovery of dislocation of joints. 整体类药，整体 means is similar to Ze means to fix T is body, so it's similar to bone setting, to fix the bones. So this was compiled by Xue Ji in 1529 AD. I would say the traumatic medicine, traumatology in Chinese medicine is a very unique specialty. Even the training of traumatic medicine, the training of this group of medicine practitioners will train separately as internal medicine. For instance, my training background, my education in China, I study internal medicine, Chinese internal medicine. Internal medicine refers to the study on herbal medicine, as well as including acupuncture, acupuncture, as well as trainer. But for traumatology, although it was introduced in the curriculum, but this is not emphasized for my program, because there would be another group of students. They specialize in traumatology. They're still going to learn Chinese medicine traumatology for 5 years for a bachelor degree. So this is a very different specialty. The training also different, but the theory still the same. The theory are still based on the yin and yang theories, the theory of 5 elements, the Zangfu organs, the connection between the Zangfu organs and the muscles, joints, ligaments. But in this specialty, they require a lot of manipulations, the skills from your hand. So they will change in the other way. You also follow your similar to apprenticeship. Apprenticeship that you need to shadow for quite a long time to feel to engage in clinical practice for a longer period in order to have accurate diagnosis and treatment. In this session, we're going to introduce the development of obstetrics and gynaecology. This category, this specialty is also quite unique in medicine because this field focuses on female and male, especially in adults, are quite similar. The only difference for this session is for gynecology, in Chinese medicine, we more focus on menstruation, anything related to leukorrhea, anything related to pregnancy, as well as delivery. So when delivery, in English, you go back to obstetrics. For instance, 精孝产保. 精孝产保, 精 is menstruation, 孝 means the efficacy, 产 is obstetrics for delivery, 保 means pressure items. This book was compiled by Zan Ying, compiled in 582 AD. However, this book was one of the earliest monograph on gynecology, but this book was lost. And the current 精孝产保, the current version of 精孝产保, was not the original one because it was lost, and then people gather different pieces of 精孝产保, they combine together, and then it has been lost for a few times. So today, you still can see this book, but this is not the original version. In this book, the author also discussed menstruations, leukorrhea, the pregnancy, as well as post-delivery. So after giving birth, how to maintain the females, the mother's health, how to manage their lifestyle, how to manage their diet to maintain their health, to promote their recovery from giving birth. And then in the end, this book also introduced different diseases related to females post-delivery. So after giving birth, because of the body constitution become weaker, or while breastfeeding, the mother also may become weaker. So in this situation, when the female, the mother was sick, how to treat the disease to protect the female, including to protect the kids, the baby. So these were all discussed in 金孝残报, and also these are the primary focuses in Chinese medicine, gynecology, and obstetrics. 实产论 产 as you can see, CHAN 产 all means delivery or obstetrics. This was compiled in 1098 AD. 卫生家宝产科备要，卫生家宝产。So this was compiled in 1184 AD, and 备产急用方 were compiled in 1140 AD. 妇人大全良方 The name of this book, 妇人 means female, women. 大全 is a comprehensive book. 良方 it means good formula. This was compiled in 1237 AD. 女科政治准绳 女科 means gynaecology. 政治 the surgeons, how to treat diseases. 准绳 means the standard. So this was compiled in 1607 AD. 纪因纲目 This is also another book in the 17th century. 傅亲祖女科 Fu Qingzu is he was also a famous figure, a Chinese medicine practitioner in the history. He also famous in calligraphy, in literature. So this book was named after him. He gathered a group of formula on focusing on female, and then he said 女科 gynecology. This was compiled about 200 years ago. Development of pediatrics. 诸病源候论 As we mentioned previously, 诸病源候论 was a monograph on the etiology and the explanation of diseases. In this book, there was 6 volumes on pediatrics. 卢信经 This was the earliest monograph on pediatrics. 小儿药证直觉 and 万密斋医书10种 All these books discuss the pediatrics. Especially in 小儿药证直觉 there were still many formulas that are commonly used today. For instance, 六味地黄丸 This, if you know Chinese medicine, you will know this is one of the most commonly used formula that's in nowadays to strengthen kidney yin. So we can use for kidney yin deficiency, such as anyone who experiences from hot flashes, night sweats, as long as you consider as yin deficiency, kidney yin deficiency, we use 六味地黄丸. As you can see from here, 六味地黄丸, although nowadays it's commonly used in adults to strengthen kidney, but initially it was developed for kids in pediatrics. That's also why the ingredients of 六味地黄丸 is actually the ingredients are mostly our daily food, and the taste of 六味地黄丸 also it tastes good because it was designed for pediatric for kids, and this can strengthen kidney, strengthen the kidney related to bones, related to the growth of kids. So this formula can be used for kidney deficiency. For instance, if this happens on kids, this can be, for example, slow growth of the body, slow growth of the teeth. if this is due to kidney insufficiency, and this formula is still commonly used today. 幼科政治准生，幼科 pediatrics 政治 to treat the diseases or treat the symptoms， 准生 means the standard。幼科集成 still， 幼科 pediatrics。The next one we're going to introduce, the last one we're going to introduce in this session is the ophthalmology and otolaryngology. 渊纪其位 1370 AD. A monograph on ophthalmology. 生时要函 Also the same on the eyes. 银海指南 This is actually a guideline on 银海. 银海 is a literature word refers to eyes. It's about 200 years ago. 口齿类药 口齿类药 口 means your mouth, 齿 means your teeth. So this is actually mostly related to dentists, dental diseases. 喉科秘书 喉 means throat. 重楼御药 was developed in 1727 AD. Okay, this is just a very brief introduction on different disciplines, and then in the next session we will have a slightly more comprehensive discussion on the development of internal medicine.